everyone, this is Dr. Hub. Today we are looking at the alcohol withdrawal syndrome. So here first we are going to see the manifestations. So first manifestation will be the tremorlessness. So what does it mean? There is a continuous tremor, there is a continuous tremor, and this will be greater than 8 Hz, or it will be the burst of the tremor activity, or it can be the burst of the tremor activity, and this will be nothing but less than 8 Hz. So the onset since the last drink in hours will be about 6 to 8 hours. Next we look at the alcoholic hallucinations. So what about the alcoholic hallucinations? So there are alcoholic hallucinations and also the psychotic and the perceptual symptoms. So there is a psychotic as well as the perceptual symptoms. So what happens in this case? In such case, there will be the visual, auditory, there will be the visual, there will be the auditory as well as the tactile. Tactile, intact orientation, or tactile, and there will be intact orientation as well as stable vital signs. And this will be the onset of drink from 8 to 12 hours. Next, we are going to look at the seizures. Next, we are focusing on the seizures. So the seizures is nothing but the REM fits. The REM fits. And the symptoms and signs is nothing but there is a single or multiple generalized tonic-clonic. There is single or multiple. Single or the multiple generalized tonic or clonic. So the onset since the last drink in hours will be about 12 to 24 hours. Will be from 12 to 24 hours. Next manifestation, we are going to see the delirium tremens. Delirium tremens. So under delirium tremens, the symptoms and signs, it includes confusion. So they can include confusion, there can be agitation, next there is a fever, then tachycardia, there is hypertension, then there is also the diaphoresis, then impaired orientation as well. So there is impaired orientation as well. So the onset since the last drink here, it will be nothing but it will be less than 72 hours. So this was about the alcohol withdrawal symptoms. To learn and grow daily, please do subscribe.